Women's health is basically a holistic approach to anything that deals with women. So it's anything from reproductive care, pregnancy and childbirth, any type of diagnoses that women may have, like endometriosis, fibroids, ovarian cancer, breast cancer, things like that. So it's really just all of the ways that a woman needs to take care of herself. Hi, my name is DJ Adams. I am the Beaumont Health Center Manager and the Women's Health Coordinator for TAN Healthcare. There's a distrust when it comes to women's health care due to the historical racial disparities that Black women have faced. A lot of Black women are afraid to go to the doctor's office because the doctors don't look like us, and so there's a lack of trust. Because women's health is not just about childbirth. Earlier, women's health is about your reproductive health, about pregnancy and childbirth. It's about different diagnoses that Black women can potentially have. You have to stay on top of your mammograms, especially if you have a family history of different breast cancers. You have to stay on top of, just your regular well woman exams, just to make sure that in the event that there is something that is medically wrong, you can catch it early enough and we can potentially reduce those mortality rates within Black women. When it comes to Black women and their health care, as far as women's health, maternal mortality rates are significantly high. It's 49.5% per 100,000 live births, which is significantly higher than any other race of women. When it comes to women's health, I have seen that among Black women, there is a lower percentage of involvement in women's health care. Black women have a lower involvement in their health care due to the historical information behind it. There are a lot of racial disparities within healthcare as far as Black women are concerned. There are a lot of just stigmas attached to Black women when it comes to their health care. And overall, I think that Black women are just afraid to go to the doctor because of the history. The top 3 diagnoses that I've noticed that Black women face as far as healthcare goes are cervical cancer, fibroids, and breast cancer. For breast cancer, Black women are among the highest race that are diagnosed with breast cancer, and also at a lower age. And when it comes to cervical cancer, Black women have the second highest mortality rate among women of different races. When it comes to Black women and fibroids, Black women are actually 3 times more likely to be diagnosed with fibroids than any other race of women. When it comes to contraceptive care, a lot of women only think about birth control. And contraceptive care is not just about birth control. Contraceptive care is family planning, it's pregnancy prevention, it's knowing your healthcare needs. Contraceptive care is used for hormonal imbalances. It's used for a multitude of different reasons, not just for birth control. When it comes to contraceptive care for women of color, I think that there is not a lot of utilization. And for example, is because HIV among Black women is at an all-time high right now. That means that our community is not informed on the resources that are out. There are injectables that Black women can take to prevent themselves from sexually transmitted diseases and infections. There are regular testing sites, regular testing facilities where Black women can know their status and they can know, what type of care that they may need for untreated infections and things like that. These health issues, I believe, Black women face because of a multitude of reasons. One could be genetics. A lot of Black women, due to, as I stated, historical issues within the healthcare community, Black women didn't go to the doctor. So it's like the issues just became worse and worse, and it's just passed down genetically. It could also be due to socioeconomic status. There are a lot of women who don't have access to health care. They don't have access to affordable insurance to go to the doctor. care. And it could also be due to just lack of the resources in the community. There are a lot of Black women who don't know about community health centers who can provide these services and get women in for, little to no cost, and help them with medications and help them with, a lot of the insecurities that they're facing due to low socioeconomic status. Some of the things that I would like our Black women to start doing is to prioritize their health. Black women should go to the doctor, go to someone that you know and that you trust, and to also advocate for yourself. If we don't advocate for ourselves, nobody else will. We have to be the voice for our health care.